Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined today by pandemic expert, Dr. Henry Wu. Dr. Wu, we are thrilled to have you with us today. I'm going to tell people a little bit about you before we get going, if that's okay. You originally hail from Hawaii. You attended the University of Pennsylvania and Harvard Medical School. You were an epidemiologist at the CDC focusing on meningitis and other vaccine-preventable diseases before joining Emory School of Medicine Division of Infectious Diseases in 2011. And you are the director of Emory's TravelWell Center since 2014. So before we jump in to all of our COVID questions that are going to come in today, tell me about the TravelWell Center. Who is seen there?
Yes, Jay, thank you. So the Emory TravelWell Center is an academic full-service travel clinic. And for viewers who aren't familiar with the travel clinic, we serve two purposes. We prepare travelers for overseas travel, and that could be vaccinations, malaria prevention, as well as a lot of advice to prevent infectious diseases and potentially other travel health hazards. We go over your background, your itinerary, your medical history, everything to make sure that you are prepared for your trip to be as safe as possible. Secondly, we are also a sick visit clinic for travelers and folks who have acquired infections overseas. So this may be things that you picked up on your travels or if you've immigrated. Often these are tropical diseases and infections that are not commonly seen in the U.S. and therefore we're specialists in this field.
You and I have talked about this before. Since COVID happened, you have kind of altered part of what you do. Can you tell me about that?
Well, as you can imagine, the travel industry has really gone down with COVID. And being a part of the travel industry, Travel Clinic is the same too. So obviously we saw our clinic volumes drop dramatically, really in line with what the airlines and all the other travel industry has seen. On the other hand, given our expertise in handling emerging infectious diseases that travelers often return with, we immediately started adapting our procedures for seeing and evaluating COVID patients or patients who potentially have COVID. We evaluated our first patient, not confirmed by any means, but we tested our first patient back in late January. These procedures stem from our experience evaluating return travelers for Ebola virus disease back in the big epidemic in 2014. We also have evaluated folks with potential Middle East respiratory syndrome, MERS, which is related to COVID-19. So we did have some level of expertise as well as our colleagues at the Ebola unit at Emory. So we were certainly more adaptive than almost any other clinic to start this work. When it became clear that the numbers were increasing, we actually expanded our services by collaborating with our general internal medicine clinics to open the Emory Acute Respiratory Clinic, which is away from our usual site because we needed a lot more room, but it is a clinic for specifically to deal with the current epidemic, to either see confirmed cases of COVID-19 or persons who might have it. And we have, again, trained staff as well as special protective equipment and facilities to do visits in a very safe way and to perform things like x-rays and things that are very difficult in any setting outside of the hospital.
Dr. Wu, let's go ahead and jump into the questions that we've gotten in advance of you and I talking today. So we'll just go through them and see how many we can get to. Beginning with, numbers are going up in Georgia and the state is fully open. What does that mean?
Well, I think it's obviously not where we want to be. I think early in the epidemic, much talk was about the COVID epidemic having peaks and the peak coming down and flattening the curve and things like that. I think we're really in a phase where we're seeing the epidemic behave differently in different geographic locations. Even within Georgia, you'll find some counties that appear to be increasing and others that seem to be going down or stable. So the reality is, I think there are many factors that can lead to increase or decrease in cases. Some of it is our own behaviors, whether it's social distancing, mask wearing. Some of it is related to the weather, we believe, and of course, things that facilitate us getting together, such as businesses and gatherings. So I am certainly concerned about the increase in cases that Georgia has been seeing in some areas. Certainly, we would like to see that go down, and I would again encourage everyone to the extent possible, follow the usual guidelines if you're adhering to keep social distancing, wear face coverings in public, and really still take this seriously. We may not have the high number of cases we were seeing in March and April, but there's no reason why we could not increase and approach that again, especially in the fall when the weather would be even more conducive to that.
A question that just came in. I have a cruise, Bahamas Mexico, scheduled in October and have not heard yet that it's canceled. Would you go if the cruise takes place?
I'd be very hesitant to go at this time. CDC is recommending travelers avoid cruises. Most of the cruise lines that depart from the U.S., I believe, if not all, are not in operation. I have heard some around the world have started again, but the reality is cruise ships are inherently a challenging place for infectious diseases, particularly highly contagious ones like COVID-19. You've also heard of norovirus, which we've dealt with many times. That's the sort of the vomiting. GI gastroenteritis illness that's often has also cruise ship outbreaks. Cruise ships, as well as things like the aircraft carrier in the Navy, are relatively unique given the close quarters, often shared facilities. It's obviously it's very difficult for most passengers to keep socially distant. It's also a mix of people from around the world. And therefore increases your chance of having an introduction of an infection. So there are some very inherent issues about cruises that do make it more risky. Certainly the industry is working hard to come up with solutions to mitigate these risks. At the moment, we're not there yet. And so until they're clear, whether it's a vaccine, a preventative vaccine, or the cruise industry is able to design a cruise or a cruise ship, or modify it in a way that can really minimize the infectious risk, I'd say it's a risky proposition at this point.
The mask debate continues very hotly, especially on social media. Please tell me in the simplest terms if they work or not.
Sure, absolutely. They work. I firmly believe it. I wear them. We wear them in clinic. I wear them in public. I think one of the confusion has come out because there has been a little, waffling from WHO, from CDC, from even infectious disease academics like myself about, recommendations. And part of that is due to the fact that we're just dealing with a very new infection, and early on, many of our assumptions that were based on other infections like influenza were not necessarily borne out as we saw more data. So I do myself share the public's confusion at times about what is the right thing, but I can tell you now that there's building strong evidence that general mask wearing in public when you're around others, again, if you're alone in the woods, obviously not particularly important, but again, when you're in public areas, whether you're traveling or just in your own community, they are potentially very helpful and very important. They, as you might have heard, they help protect others if you are sick. Certainly, we think that's probably a lot of the effect. And on top of that, I'll go on a limb and say I think even if the data is not there yet, I think there are protective effects for the wearer too. I can guarantee you, if I was in a room full of folks with COVID, and in my line of work, I do go into rooms with folks with COVID, I'm wearing a mask. And it's not because I'm worried about infecting them, to be honest. We're protecting ourselves too. Again, I can't put a number on it, but I can tell you it's probably helpful and certainly something I would do. It's easy. It's certainly cheaper than the vaccine. We don't even have a vaccine yet. So, I think if you can get into the habit, I think it's a great idea. And again, if you've traveled to Asia, you've probably seen countries where they're already in the habit long before this epidemic.
So we have a slew of travel questions that have come in for you. So we're going to try to click through as many as we can. Sure. What about travel to areas with low numbers like New Orleans and Memphis, etc.?
So certainly, if you are not sick and you're going somewhere, I totally agree. The highest risk place is going to be somewhere with high numbers. If it's somewhere with low numbers, that's potentially a lower risk trip. I would throw in some caveats though. First of all, there's not just the destination, but it's the travel itself. So if you're flying, you may be going to an airport mixing with people from around the world. You may sit on the plane with somebody who's potentially ill. If you're driving, you may have to stop along the way, again, in gas stations, restaurants, rest stops, and again, mix with folks from around the country, if not the world. So it's a little hard to completely be sure about the actual epidemiologic risk of a trip. And on top of that, we've also seen the epidemiology of disease change rapidly. So even if the numbers seem like the place is okay, that could change in a week or two. There's always a lag time in being able to monitor an epidemic. So again, what's true now may not be true when you're there. And so I would be highly cautious. And finally, because you may even be feeling well, but possibly be carrying the illness, if you travel somewhere with low risk of disease, you may be that person that brings the illness there and gives them a problem. And so, again, I think I would keep that in mind, especially if you're visiting folks who may be elderly or loved ones who may bring, or anyone who may be at particular risk for disease. For all these reasons, I still think we're at a point where I encourage folks to not travel unless there's a strong reason to do so.
Any idea when Canada might open its border? We have a flight there in August.
That's I don't have any idea. I can tell you, it's as long as our numbers in the U.S. remain high, I don't think I would expect a change anytime soon. Yeah. That's and that raises a bigger issue. Many countries around the world have policies, whether it's strict border closures or restrictions of Americans. There could be testing on site. There could be mandatory quarantines. In fact, there's some within our own country, such as the state of Hawaii. And some of these may be come up unexpectedly. Some of them may be difficult to figure out, especially in some of these international locations. So traveling has its own risk of just pure disruption. Meeting an unexpected quarantine or being sent home or being subjected to a test, an invasive test like a nasal swab. So these are very potentially challenging times to travel.
What precautions should we take if renting a house this summer?
I would say, if you are ever staying in a place that's not your usual home, and so whether it's a vacation rental or an Airbnb or a hotel for that matter, I think the general I think there's similar guidance as far as I'm concerned. You obviously want it to be, if it was recently vacated or used, it needs to be cleaned, obviously. Hotels obviously have adopted more aggressive cleaning measures. And I would certainly be asking a Airbnb host or whoever's managing a rental about their cleaning. It could certainly be not a bad idea to do your own cleaning when you get there. I don't think I would go crazy, but it certainly would be an easy thing to do to wipe the high touch areas. I'm talking about
Right.
doorknobs, light switches, and the faucet handles, the things that are most likely that somebody had recently touched. Here's the good news about sort of spaces like that. We do know that the virus does not stay viable on environmental surfaces forever. Certainly not, you know, more than several days. It really depends on temperature, type of surface, humidity. But if a house or room's been empty for a week, I'm not particularly worried about any viable virus. On the other hand, if it was recently vacated or even literally somebody was in a room, 15, 20 minutes before you were, that I'm more concerned about. There could be a viable virus on surfaces. If it's been really recent, there may be even something in the air still. So time is on your side. I certainly, if I were checking into a hotel room, I'd ask which room has been vacated the longest.
What do you think about schools reopening in the fall?
Oh, I think this is a challenging one. I certainly, I probably can just address this from an infection standpoint. Obviously, I know school's important, and school at home, has not always been ideal for everyone. But I am somewhat concerned. Many of us feel that children might play a role in spreading the illness. We do know that younger individuals, including children, acutely are much more likely to have mild or even asymptomatic infection. However, we do know that this infection can be spread by those who don't have symptoms. So schools might play a role in amplifying this epidemic. We certainly don't know that for sure. We do know from our experience with other infections, such as influenza, that schools and children's are a situation that can amplify the infection. Now, certainly the schools and universities that are thinking about opening or planning on opening are thinking through this very carefully. So it's certainly the good news is that as far as I know, every university and school system that has opened has thought carefully about distancing, changing activities, basically changing the way it looks and is run. So I think so. In short, I think we may have to, but I think if the best way to do it would be to basically change the way we are doing things in school.
I'm going to combine a couple questions here because they're on the same topic. So I'm going to read you 3 questions, basically all about the same thing. What are your thoughts on road trips? What precautions do you suggest when going on a road trip and staying in a hotel room? Should we ask hotels any specific questions?
Sure. And so I addressed the hotel part again. And now, by the way, hotels, again, the room itself, if it's been vacated and cleaned, I'm much less worried about that. Yeah. However, if the hotel has a crowded lobby, an elevator, a restaurant you might go to, that to me would be the more higher risk areas. Again, that's where you might be in closer contact with other individuals. So again, large hotel chains are taking precautions. But again, as a traveler, I'd be very careful when checking into a hotel to making sure I'm keeping my distance. And on top of that, of course, as I've said, some precautions with the room itself. Regarding road trips, potentially it's obviously your own car, especially if you're traveling alone or with your immediate family that you already live with. It's an environment where you're obviously protected. However, of course, if it's a long trip, you're probably going to stop, whether it's a bathroom break or a gas stop, food, etc. So these are all, again, opportunities to potentially get into closer contact, such as contaminated surface, etc. I would, there are some ways you can can minimize that risk. Obviously, bring all the food and water that you're likely to need, and so to reduce your risk of the need to even stop anywhere. Certainly, when you do have to stop, and obviously you may have to stop for a gas or a bathroom break, be sure when you're out to be wearing your mask and be very conscious of your hands and what you're touching. Anyone who's traveling or out in public in general ideally should carry some hand sanitizer.
Mm-hmm.
That way, you can clean your hands again after coming out of the bathroom or pumping your gas. I do encourage folks, and I'll say it now, but I think this is a good time for folks to rethink their activities. Where are your hands touching? What have they touched? Could they be contaminated? And being very mindful of that, as well as what you're touching next. So, you might watch me in this video, and I've got my guard down because I'm sitting here at home. But you might see me, do this and that, and we all do it, and we don't think twice about it. But increasingly in public, we really need to be mindful of that. And I can tell you, I'm very good about that in public and in my clinic. You'll see me in clinic standing like this. People ask me if I'm cold. No, it's because really, I'd rather not do this, or brush against something accidentally, which we do all the time.
Right.
Or again, scratch that, nose or something. It's really just internalizing that, the distance part with people, internalize that. In normal times, what's our quote personal space? 3-4 feet. When a stranger walks up to you and says hello,
right.
We're not threatened if they're 3 or 4 feet away. If they came 2 feet close to us, we'd be like, stay away from me. What are you doing getting so close to me? Well, we got to expand that, what we define as personal space. So it's not just stand 6 feet apart when you're in line. It's really redefining what's personal space. When you're walking down the street, when you're going into a restaurant or somewhere where you have to go into, if you see that it's crowded, if I see something's crowded, I'm pausing. If I see a bunch of people coming out the door, I'm waiting till they come out. If I see an elevator open and it's full of folks and I'm not going to be able to keep my safe distance, I'm not going in if I can help it, And there may be such situations where you can help. And again, that's where the mask wearing and the hand washing is important. So, keeping all these things in mind will help you when you are at the airport on a road trip to start really do what I do, which is analyze every specific situation. Yeah. Because there's going to be a restaurant that's serving something outdoors on an open stand. You can sit in a park bench. You're not going to be close to anything. You're being very good about wearing masks. I'm not particularly worried about that. If I have to eat there, that's where I'm choosing. If I see somewhere where, it's all indoor seating, they're a little too close, the servers are, not wearing masks or halfway, I might pass on that. So, the good news about road trips is that you have more of a choice. You see something you don't like or that doesn't look good, move on.
Keep going. As always, we thank you for joining us for our Facebook Lives with our pandemic experts here at Emory, and we will continue this next week with the return of Dr. Carlos Del Rio. Dr. Wu, thank you for joining us. We appreciate your time. And everybody at home, stay safe, be well. We'll see you soon.